So today we continue to review the wonderful, amazing book of Dr. Gabor Mate, When the Body Says No. And he talks about several wonderful topics in this part of review. And we start with the topic of cause and effect. Western medicine has multiple cause and effect topics. For example, when it comes to multiple cancers, such as lung cancer, head and neck cancer, cancer of esophagus, cancer of bladder, smoking, it's considered as a cause. But Dr. Gabor Mate argues that when you consider something to be cause of something, you have to consistently see that that particular factor is causing the cancer. But for example, in lung cancer, you see that not everybody who smokes gets lung cancer or bladder cancer or head and neck cancer or cancer of esophagus. And we do see people who have lung cancer and who have never smoked, or head and neck cancer or bladder cancer who have never smoked. Another factor that they blame cancer on is mutations. BRCA mutation is blamed for breast cancer, ovarian cancer. And even though about 85% of people who have BRCA mutation develop breast and ovarian cancer, there are about 15% of them who don't. So Western medicine has a tendency to focus on those who are smokers and get lung cancer or have a mutation in BRCA and get breast and ovarian cancer, rather than focusing on those who don't. So what is different about people who smoke and don't get lung cancer? What is different about those who have BRCA mutation and don't get breast cancer? That is the question. So in theory, if smoking or BRCA mutation is the cause of lung cancer and breast cancer, it has to cause cancer 100% of the time. If it's not causing cancer 100% of the time, it cannot be cause of the cancer. There has to be something else. And that is really the case. There are other causes. So what Dr. Gabor Mate is proposing is that trauma and personality traits as a result of trauma create a perfect storm. He's not saying that smoking or BRCA mutation is not playing a role. He's saying they do play a role. But the difference between the person who's smoking and gets cancer and the person who is smoking and does not get cancer is the trauma. The other very interesting factor discussed is the placebo effect. So historically, when we give sugar pill to people who either significantly get improved in their symptoms or they get healed completely, they say, oh, it's a psychological thing. But Dr. Noel Hirschfeld in 1997, he is a Calgary gastroenterologist and published an article in Canadian Journal of Gastroenterology and looked at psychoneuroimmunology factors and came up with the 55% rule, because in general, 55% of people who get placebo have either improvement or reduction of the symptoms, or have promotion of healing just by a sugar pill. And placebo effect is really entirely a physiological response, some neurological or chemical processes in the body that causes that effect. And what he proposed was that we need to study these people. It's just, we can't just dismiss this kind of significant response and say, oh, it was some suggestibility or some kind of psychological response. We need to study these people. We need to find out what kind of people these people are and what kind of environment they're living in. Is there something in their past experience that produces this response? What kind of lives they are leading? Are they content with their existences, upbringings, marriages, relationships? Is their attitude one of, well, I'm not going to have this happen to me? Are they some kind of people that they make an immediate decision to take charge when something bad, a disease happens to them? So from this point, Dr. Gabor Mate discusses a type of personality in malignant melanoma patients that is called personality type C. We are all familiar with type A and B personality. Type A personality people usually are tense, maybe a little bit angry, fast, a little bit aggressive. They usually want to be in control, and they're more prone to heart disease. Type B personality are more balanced, more moderate. They can feel, they can express their emotions without being too driven, without losing themselves in uncontrolled or emotional outbreaks. What is proposed for type C personality is they are extremely cooperative, patient, a little bit passive. They lack assertiveness and are too accepting. And while type B and C personalities, they may resemble because they both seem easygoing and pleasant, type B can easily express anger, fear, sadness, and other emotions, but type C individuals suppress and repress any negative emotions, particularly anger, and struggle to maintain a strong and happy facade. Their niceness and lack of aggression are lifelong patterns having their origin in their early childhood. And unfortunately, when people are diagnosed with a disease, whether it's cancer or cardiovascular disease, they don't suddenly change their usual ways of coping with stress and suddenly develop new patterns. Under stress, they usually mobilize their existing resources and defenses. A very interesting study by researchers in Australia, they looked at personality traits in patients with colorectal cancer. They studied over 600 people and they compared them with a matched group of people, and they found a statistically significant degree of the following traits. These people had elements of denial and repression of their anger and other negative emotions. They had external appearance of being nice and good people, a suppression of reactions which may offend others, and avoidance of conflict at any cost. The risk of colorectal cancer was independent of previously found risk factors such as diet, alcohol intake, and family history. Their self-reported childhood and adult unhappiness was also more common among these patients with colorectal cancer compared to the matched group. Interestingly, similar traits were found in patients with breast cancer, melanoma, prostate, leukemia, lymphoma, and lung cancer. Another very interesting study by Johns Hopkins University in 1946. They looked at their medical students, 1,130 white male medical students. They followed them for 18 years after they did some psychological testing in them. After 18 years of follow-up, they looked at their health condition. They developed a variety of health conditions such as heart disease, high blood pressure, mental illnesses, and some of them developed cancer and some of them committed suicide. There was a striking similarity between those who developed cancer and those who committed suicide. And in those who developed cancer or committed suicide, they noticed that they had a tendency to deny and repress conflictual impulses and emotions to a higher degree compared to others. They had the lowest scores of depression, anxiety, and anger. And that was because they were least able to express emotion. It wasn't because they were not depressed, or they were not angry, or they were not anxious. They had all those feelings. They were just suppressing them. They also reported being the most distant from their parents. So there are certain personality features that definitely increase the risk of cancer simply because they generate physiological stress. And in the last session, we discussed how chronic stress response affect our cortisol level, our immune system, our hormonal system. So repression, the inability to say no, a lack of awareness of our own anger, make it much more likely that a person finds himself or herself when their emotions are unexpressed, their needs are ignored, and their gentleness is being exploited. Common to all of these people is a diminished capacity for emotional communication. So these situations are stress-inducing, whether a person is conscious or unconscious of it. We talked about it, that the stress doesn't need to be conscious. When stress is unconscious, is just as bad. Repeated and multiplied over the years, it has the potential of harming our homeostasis and our immune system. Therefore, physiological stress is the link between our personality traits and the diseases, chronic illnesses, including cancer. The emotional context of childhood interacts with inborn temperament to give rise to personality traits. Much of what we call personality is not a fixed set of traits. It's only coping mechanisms a person acquires in childhood. Therefore, there is an important distinction between inherent characteristics rooted in an individual without regard to the environment and a response to environment, a pattern of behaviors to ensure survival. An infant or a child who perceives that his or her needs are unmet may develop an obsessive coping style, becoming anxious about every detail. When such a person fears that he or she is unable to control events, he or she experiences a great deal of stress. So people around him or her will resent him. And then that person starts disliking herself or himself for what was originally a desperate response to emotional deprivation. So the drive to control is not an innate trait, but it's a coping style for survival. A very important question that Dr. Mate asks every individual he deals with. And he says that in his years of practice, he has never gotten the answer yes to this question. And I would like to pose that very question to you, is this. When, as a child, you felt sad, upset, or angry, or an adverse childhood event, such as emotional abuse, physical abuse, sexual abuse, happened to you, was there anyone you could talk to? You could report that event to an adult in your circle, whether he or she was the one who had triggered your negative emotion or not. Anybody, a parent, an uncle, an aunt, grandmother, anybody. Was there anybody that you trusted to go to and talk about your sadness, talk about your fear, talk about your anger, report something really bad that happened to you? Was there anybody that you reported something bad that happened to you? If the answer is no, Dr. Gabor Mate says that the trauma was that. The trauma had happened. If you were sexually abused and you didn't trust anybody, any adult in your life, to tell them about it, the trauma had already happened. You as a child had already learned that there was nobody, no adult in your life that you could trust to go to tell them about what was happening to you in your life. And the main trauma was just that you felt alone, that you felt unprotected. And what he proposes is that the predator in your life didn't choose you just by accident. The predators know by absolute certainty who to choose. They know they never choose a child that would talk to somebody. He has talked, he has interviewed the predator. They know with absolute certainty which child to choose. In a group of children, they know who to choose because they know which child does not trust her or his parents or the adult in his or her environment. And they, with absolute certainty, choose that very child, whom they know will not talk, would not tell the adult in her or his environment about the abuse. They know. They choose the already traumatized children. Why the children don't tell the people who are supposed to protect them? Why? Because the parents themselves are too threatened by the anxiety, anger, or sadness they sense in their child, or are simply too busy or too harassed themselves to pay attention. The child feels that their mother or the father needs them to be happy. So this becomes a simple formula in their life. My parents need me to be happy. They learn to suppress their negative emotions. And they carry this formula into their adulthood. And this suppression of negative emotions carries into their adulthood, becomes personality type C, leads into chronic illnesses, including cancer. Unfortunately, the most public layer of personality is the most superficial one. So on the surface, they look happy. They look just fine. That's not what is inside. They look nice, they look happy, but that is not what is going on inside. Even strong convictions of having a powerful sense of self is the facade. It's very often quite the opposite. The intensely held belief about themselves, it's really covering the experience of a vacuum inside. They never say no to anything because they don't want to hurt anybody's feeling. They work very long hours. They even don't have vocabulary to express their feelings. When they're asked about how are you feeling, they respond by thoughts. If you ever watch Dr. Gabor Mate interview one-on-one a person, very often when he asks, okay, so how are you feeling? And the person responds, Dr. Gabor Mate very often says, that is not a feeling. That is a thought. I asked you how you're feeling. I didn't ask you how you're thinking. So he often has to just dig deeper and correct them and say, that is not a feeling, that is a thought. Simply, most of the time, all of their emotions are frozen. They have an overwhelming fear of abandonment. They grow up believing that they have to take care of everybody because they had to take care of their parents. They often don't have any internal resting place. Dr. Gabor Mate says that the assertiveness to defend one's boundaries can and should appear aggressive if need to be. Studies on animals who are dominant shows that the dominant animals have lower level of cortisol. And in female dominant animals, their cycles, menstrual cycles, are regular. Now, if they force these dominant animals to become subordinate, their cortisol levels go high and their cycles become irregular. The very same thing happens in human beings. When female human beings are not assertive, they lack boundaries, their cortisol levels go high up. Their menstrual cycles are abnormal. Their ovulation becomes abnormal. They develop infertility. And when the hormonal system becomes imbalanced, guess what? A lot of our female organ cancers are directly correlated with our hormonal imbalance. And as I discussed last time about P&I axis, pineal gland, adrenal gland, that is the axis of stress response. It doesn't stop at adrenal gland. It goes down to ovaries. Ovaries, they have a correlation with breast. So in female, cancers of breast, cancer of ovaries, they have something to do with lack of boundaries. They affect our sleep. In men, it has something to do with testicular cancer, with prostate cancer. It's very interesting. There is an author, her name is Isabel Balrus. When I consulted her about my sleeping problem, which is the subject after I finish this book, she used an amazing analogy which helped me resolve my sleeping problem. She told me, in a wolf pack, there's a dominant wolf, and then there are these subordinate male wolves. The subordinate male wolves, they're afraid of the dominant wolf. The dominant wolf is the only wolf that can mate with the female wolves. Therefore, the subordinate wolves, their testosterone or whatever hormone, it drops. They don't dare to get even close to the female wolves. The other thing that happens to them, they don't sleep at nights. They're afraid that the dominant wolf may kill them at night. So they're up all night. They sleep during the day. The entire hormonal system is messed up because they're subordinate. She told me that because of your childhood abuse, you became a subordinate female. That's why you don't sleep at night. You have to become an alpha woman. That's the only way you can sleep at night. You have to come out of the victim mentality. You have to write a letter to all of your abusers, forgive them, take 100% responsibility. Those are all your creations. When you become an alpha woman, you can sleep again. So I'm going to stop here. Next week, we're going to go into each different cancer, because even though, for the most part, these personality traits are shared in cancer patients, each one of them are a little bit different from each other. So we quickly go over different ones: ovarian cancer, breast, lung, prostate cancer, testicular cancer, very briefly, very quickly. And in the following week, we're going to go into how you have to change your personality traits. Yes, you have to change them. This is a wake-up call. You have to change. You change, and by changing your personality traits, you can heal yourself. And after that, we go to the subject of sleep. Thank you very much for participating.